Chekuri Suvarchala, Scientific Director with Ziva Fertility Centers. Will the procedure of IVF finish all your eggs in the ovary? This is a very important question that patients ask us when they come for IVF, and they're very apprehensive that one cycle or 2 cycles of IVF may finish their eggs. So the answer to this question is no, definitely not. I'll tell you how. Basically, all the eggs in your ovaries are decided before you are born. So once you are in the fetus of your mother, the eggs are growing inside the ovaries, and about 2 to 3 months before you are born, the egg manufacturing stops. Once you are born, the number is decided, they are finite, the eggs are remaining in a, so to say, a sleeping stage. But at the time of puberty, when you start your periods, that's when these eggs are activated. Every month, one egg is released, and this is the egg that is waiting for fertilization and will form a baby. But if there is no intercourse happening, this egg will degenerate. What is basically happening is that every month a cohort of eggs is selected, as in a group of eggs are selected. When the brain is producing hormones such as FSH and LH, follicle stimulating hormone or luteinizing hormone, these cohort of eggs try to grab the hormones which are released. But out of the cohort, only one is dominant, that is, one is able to take up all the hormone which is released. So only one dominant egg can, so to say, grab the hormonal signals, and that is the one that is released. So this cohort is the cohort which releases just one egg. Every month the cohort is selected. So what happens to the other eggs from the cohort? They degenerate, or so to say, they are destroyed. So it's not to say that every month only one egg is selected. A cohort is selected of 10 to 20 eggs, but out of this 10 to 20, only one is released. This is what happens till menopause. As you age, that is after 35, the size comes down. So that's because the dormant ones, the ones that are in the sleeping stage, also become less efficient, and therefore the number of eggs which are selected into the cohort also keep coming down. This is what is happening during a natural female's age. During IVF, FSH and LH are also given externally. What we are trying to do here is to mature all the eggs in the cohort. We are not trying to mature all the eggs in the ovaries. Only the ones that are selected this month as a cohort are being grown. So the cohort, suppose it is of 5 eggs or 10 eggs or 20 eggs, the cohort which is selected for that month is made to grow in size, and those are the eggs which are collected. This is what happens, and all the fertility drugs do not have the effect of growing all the eggs inside the ovaries. These effects are very short-lived because the injections are given only for 10 days. Therefore, the effect of these injections are also short-lived, and next month again you can go back to your natural cycle cohort selection. This is what happens, and you will not lose all your eggs during IVF or after IVF stimulation of drugs. If you want to understand more, if you are apprehensive about what IVF is and how it is performed, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.